Hey, Jan. Yeah.
Hey, good morning, everyone, and good evening, good afternoon. Hello, guys. Nice to see everyone. I think Simone is having some trouble with her connectivity. Let me just unmute her and see what's going on. And hi, Tinka, Sylvia. Hello, Albert. According to Albert, this will be a very interesting episode of our show. And Yvonne is here. All the Yvonnes are here. Dagmar and Philip. Hello, everyone. Ernst, hi. Cindy, good morning, and good afternoon, good evening. Hi, Simone, are you with us? Oh, that's
nice to see you all again. It will be interesting today.
Yes, you're back. Let me just take my place as the host here.
Hi, Jan-Jaap.
I hope for everyone the quality of our stream is looking better than for us at the moment.
Okay. Yeah, it's not.
Yeah, so for me, Simone,
stable,
you are constantly chopping in and out of audio, and Jan-Jaap, which is this gentleman right there. He's our guest for today, and welcome, Jan-Jaap.
Thank you. Looking forward.
Nice. It's very nice to have you with us on the show. And once again, everyone, good morning. Huub, Paul and Yvonne. Hello, guys. Nice to have you with us once again.
Everybody,
before we
our stable crowd.
Yeah. And once again, I want to thank everyone mentioned in the introduction, and not just there, but in the meantime, more and more people have donated to our cause, meaning the existence of Thalassa here in North Sulawesi. So from all of us, from Simone, from myself, from everyone here, thank you so much, including you, Jan-Jaap. Thanks a lot for your generous and kind donations, and please keep spreading the word. Before we continue,
help.
Yes, definitely, it's definitely helping a lot. And before we go continue with the show, I want to ask you, please share this live stream with people in your network. Let them know it's going to be very interesting. We're going to talk about a lot of very interesting stuff. But yeah, Jan-Jaap. Simone, would you like to introduce Jan-Jaap to everyone?
Yeah, well, sure. As far as I know, we know each other for because and for that time you were the do you hear me?
You're breaking up for me. Can you hear me fine, Simone? And I think Jan-Jaap is also having problems.
I can't do any lip reading, so it's hard for me.
You don't hear me?
Let's just. Yeah, I hear you, but I hear you very late. It's with a huge delay, and there's a lot of chopping up of your audio. Maybe it's an idea, Simone, just to kind of clear the signal to.
I leave and I come back.
Yeah, all right. We'll talk to you in a little bit. So in the meantime, Jan-Jaap, unfortunately the connection is not working for Simone right now, but can you please tell everyone who you are, what it is you do, and what do you represent It's very interesting stuff.
Actually, I will start with Simone's introduction. We know each other a very long time.
Right.
So it's about, I think, 15 or 20 years. We have been guests in Santika for the first time somewhere back in 2004 or 5, and ever since we keep in contact, and we returned quite a number of times to Thalassa for our courses in diving medicine. And actually, that's my main issue today: diving medicine, but not for doctors, what we are usually do. But now we are going to talk diving medicine for divers. For me, that's new too, actually. But I hope that it will be an interesting presentation.
Awesome. Great.
Sure,
let me just.
Will be.
I think so. And familie van der Maas, di sana kami lagi. They're practicing their Indonesian.
And
good to have you
Joram,
with us.
Mr.
Yes.
And it's not, Joram is a free diver.
Yeah. So shall we continue, Jan-Jaap? Are you ready?
Yeah, that's okay.
All right, here we go.
Okay. Let's go.
Well, actually, what I'm going to do today is I'm going to talk about holiday diving or a diving holiday. There's a difference between those two. My background, as you can see, is hyperbaric and exercise physiology. So it's from, a medical direction. I'm the director of the Scott Haldane Foundation, and we're going to talk about the Scott Haldane Foundation in a few seconds. What can you expect today? It's a short introduction of Scott Haldane Foundation. What's the difference between holiday diving and the diving holiday? We're going to discuss the medical aspects of holiday diving and diving holiday in the different stages of the dive. And we will conclude with some take-home messages, which I hope may be very useful for you as well. Well, Scott Haldane Foundation, it's 45 years of diving medicine this year, founded back in 1976. And we're still learning from the past and looking into the future concerning diving medicine. It's education in diving medicine for doctors. That's what we do. We organize courses, conferences, and workshops. And we organize accredited events, internationally accredited events, international programs for the certification of diving doctors. And we do those courses all over the world. And on a yearly basis, we do 12 to 15 events per year. Though I must say that COVID restricted us in 2020. And so we did about 6 or 7 courses last year. But this year we have, again, 12 courses on the calendar. But, well, we have to see what's going to happen this year. At least the first 2 courses are next week and the week after here in Amsterdam. And those courses are on the go. We, as the Scott Haldane Foundation, organized the World Conference of Diving and Hyperbaric Medicine back in 2013 on the beautiful island of La Réunion. We did that together with the EUBS, which is the European Organization for Diving Medicine, the SPAMS, which is the South Pacific, an Australian organization for diving medicine, and the SOMA, which is the same organization, but then for the South Africans. And we did it again in 2018 in Durban, South Africa, where we co-organized the World Conference on Diving and Hyperbaric Medicine again. We have a lot of parties we are working together with. As you can see here, I'm not going to name them all, but it's the world organizations from the 4 continents, actually. It's then Europe and Southeast Asia, and a lot of organizations in the military world, in Sweden, Oman, and Belgium, and of course with the Royal Dutch Navy as well. What we do is we organize courses, and here you see an example of some students in one of our level 1 courses, which were introduced to all types of diving material. So it's also a practical sessions we have. Everything they preach, they have to practice as well. So they have to do the diving medical in the course, where they are the doctor and the patients, or the diver actually, it's not a patient. So they have to do all the exercises as well, and all the practical medical research and investigations as well. They also have to practice dive material. Here you see the full face mask, which is for a fairly large number of them is really new. And we do it all over the world. Here you see a course in Raja Ampat, which is not the worst place to have a course, of course. But also on the Seychelles. We do it on Sipadan Island. And we also go to Bali, where we instruct the doctors the then first aid kits and how to do that, how to use them. They also have to practice first aid, of course, and resuscitation. And even in water resuscitation is part of the course, which we did in where was this? In Nosy Be, Madagascar. And of course, we have the best available teaching staff: Professor Kot from Poland, Professor Van Hulst in the Netherlands, Professor Sterk also from the Netherlands, and we have Professor Bennett from Australia, Dr. Jan-Jaap from Belgium, Dr. Prince from the Netherlands, Simon Mitchell, Professor New Zealand, Professor Moroni from Italy, Sylvia Dermaat, Dr. Sylvia Dermaat from the Netherlands, and Dr. Menno Gastra also from the Netherlands. So we do have a large teaching staff with a changing, we try to find the best teachers for the subject we have in our courses. We organize now about 40 different courses, and 30 of them have different subjects. So per course, we look at who is the most known presenter for the subject we have in that course. So our aim actually is improving diving safety by giving diving physicians the best tools. And well, that's the short introduction of the Scott Haldane Foundation. What are we going to talk about today? We are going to talk about holiday diving, or the diving holiday. Is there a difference between them? Yes, there is. This usually is the holiday dive. People who go on holiday and never dove before, or they had a underwater, an open water course, let's say about 10 years ago, and now they go to the Maldives. This is, by the way, the Maldives. Where they have a nice vacation, and then they think, hey, maybe it's nice to do an introduction dive, or it's been 10 years ago, let's go diving for one day. This is the diving holiday. Usually people plan their trips very well. They do a lot of diving, and the primary aim of that holiday is diving. They try to find some challenges in diving, and that's their fun and aim for this holiday. Usually you see the holiday diver with a very lightweight traveling. They don't bring their own dive gear, and that is different from the diving holiday diver, which usually have too much dive gear for the trip. Because most trips, especially when you're from Western Europe or colder areas in the world, you need a plane to reach your beautiful dive destination. And so the next thing we see is the takeoff of an airplane. And an airplane is not the really nicest environment to be in for a diver. First of all, your seats are cramped, the plane is full, and there's hardly any space to rest. You can find some, but since you have a lot of gear, these overhead compartments are occupied as well. Another thing with flying is that the air in an airplane is very, very dry, and you really run a risk of dehydration. So you must drink a lot of water during your flight and directly after your flight. So then you arrive on your destination, and this is a typical holiday diving couple with rental gear, the warm waters, so you don't have any protection. Arms and legs are not protected, and that's different usually from the diving holiday diver, which bring their own gear, usually a full wet or even semi-dry or dry suit, when necessary with gloves and booties. So it's more heavy, and also it's a bit more protective for the dive they are going to make. So to explain some more differences, the holiday diver usually makes 1 or 2 dives during the whole holiday, while the diving holiday diver make many dives during that holiday, because that's their aim, to make not as much as possible dives, though for some it is the aim, but at least to make many dives. Usually it's a long time since the last dives, and the skills and procedures of the holiday diver are not really up to date. If you don't dive frequent, you have to do some checkups and make some practice some skills before you start diving again. While the diving holiday diver usually is a frequent diving, skills and procedures are up to date. Usually it's good when the holiday diver takes some guidance. They need guidance actually. It's a lot safer, while the diving holiday diver usually is self-supporting. And they are uncertain, the holiday divers, since their last dive was a long time ago. Skills and procedures are not up to date. They are insecure and more careful, and they are panic prone. So they are not used to situations where they are not what they don't know anymore actually, because they don't practice them. And the diving holiday diver, due to their frequent diving, their skills and procedures are up to date. Sometimes, and that's a disadvantage, they're overconfident because, oh, I know everything. I made so many dives, and they are sometimes are really careless. And that's also a situation where they are prone to diving accidents. So it's not that the holiday diver get more accidents than the diving holiday diver. No, that certainly is not true. Because they are more careful and they have guidance, they usually are safe divers as well. Well, how do other people think about diving? If you look at your neighbor who doesn't dive, or the rest of your family further away, your aunts and uncles, then it's usually, oh, diving, isn't that dangerous? Isn't that something with decompression sickness or bends, or that's very dangerous? You shouldn't dive actually. And this misunderstanding, even dive operators, I wiped out the names of the dive organization, but they say DCS, decompression sickness, is the most common serious diving injury, and it's often called the bends. Yes, the last thing is correct, but I don't know about you, but I didn't see many decompression sickness accidents and injuries. I saw a couple, but it's not the most common serious diving injury. And that's one of the things I want to discuss in the rest of the presentation as well, and show you that there are a lot more other diving injuries which are much more common and which are at least as dangerous as decompression sickness.
Yeah, just as a comment for that, Jan-Jaap.
Yep. Sorry?
I think in the 24 years I'm running dive operations here. In the 24 years I'm running the dive operations here, I think we had a total of about 10, 11 decompression cases, and all of those had a medical background.
Yeah, so they are more or less
PFO or medicine or something. They are more prone, but it doesn't happen often. Yeah. It's definitely true.
Thank you, thank you. If you look at the kind of dive injuries which are happen more often, then they are mostly related to directly related to pressure and the inability of the diver to react adequate to the pressure change. And in dive terms, we are talking about barotrauma and squeezes. And they can be very serious as well, and they happen much more often than the decompression sickness. Well, we need a little diving physiology and physics. Some of you will be very familiar with that, and for others it will be maybe a good refresher. As we know that as soon as we enter the water and we descend, that the pressure will increase, and according to Boyle's law, the volume will decrease. And that's in a way that when the pressure doubles, you go from the surface to 10 meters of depth, you go from 1 to 2 bars, the volume in a closed gas-containing space will halve. So let's say there is a volume of 4 liters. At 10 meters, the volume will be 2 liters. You can practice that with a balloon, and you will see that doubling the pressure will halve the volume. On the other hand, when you ascend, then you know that the pressure decreases and the volume will increase accordingly. Keep that in mind. If we talk about air-containing spaces, then we do have a lot of air-containing spaces in our body. Some people think that this is the largest air-containing space in the body, and for some divers, it's some people actually, I should say, it's true, but actually that is brain, and brain should be a solid or fluid-like substance. But in the face, we do have some air-containing spaces, like the sinuses here and here and here, and also here you have a sinus. And there is no problem with the sinuses as long as they can ventilate with the environment, and the pressure in the sinus is the same as the pressure outside. There's another very small space which can be very, very nasty when you have problems with that, and that's the middle ear. Here you have the ear canal, the outer ear. Here you have the middle ear, and it's separated by the tympanic membrane, the eardrum, trommelvlies, and this is the inner ear, which is filled with fluid. So you don't have any problems as long as the separation between the inner ear and the middle ear is intact. Here again, there's no problem because you have your Eustachian tube, the buis van Eustachius, which takes care of a equalization of the middle ear during a rise and decrease in pressure, because there is a open connection to your mouth and to the outside world. But if the Eustachian tube is blocked, then here you have a closed area filled with gas. Well, in our body, probably the largest area where we have gas, that are the lungs and the airways. Here you see everything which is pink in this picture. That's filled with air.
Jan-Jaap, sorry to interrupt you there.
Yeah.
We're not seeing your pointer on screen. That is not your fault, but just so you know.
Oh, okay.
Okay.
It's well, actually, the pink area here in the lungs are the areas which are filled with air, and here you see another picture of the lungs, again with the airways. On the upper right picture, you see the open airway and a narrow airway, and that's a problem, of course, because if you close the airways, then all air-containing spaces behind or after that closed airway is blocked, so there is no ventilation possible. And if you look at that, then you can see, for instance, with asthma, that you see that the airways, a normal airway with a large opening, and the asthmatic airways are getting blocked. So there is no ventilation possible, and that's due to inflammation and spasms, so that and mucus forming, so that there is no air can pass through. And especially you see here that asthma can develop in these smaller parts. You see the little how would you call them, the little bubbles on the end of the airway. You see them. Sorry?
Alveoli, toch?
Yeah, that's the alveoli.
Alveoli.
And the bronchioli on the left picture. They are blocked first, actually, and the previous picture where you see the blockage at the high end, at the trachea, at the luchtpijp, that is not really. That's a really serious situation. But asthma usually starts on lower parts. Another possible air-containing space is in the teeth. When you have a filling which is not completely covering the whole of your teeth, then there can be an airspace between the filling and your teeth bone, actually. And that's also very nasty when you have volume changes in an area, because also the nerve of the tooth is very close to that area, so that will be also it will hurt when there is a volume change in that filling, in that airspace.
Yeah,
there.
I experienced that firsthand. It was on my first open water dive, and we descend down to 12
Not
meters,
funny.
and no, not funny at all. But it was in my front tooth, and it hurt a little bit. And then I indicated to my instructor I have some problems, and then we ascended a few meters, and it was gone. And it never returned after that either. But that was the only time that happened to me.
Okay, well then you're lucky that it was over without seeing a dentist. Usually, what happens is that it will try to break its way through your dent, actually, or through your filling, so that there is a little way to equalize the pressure in the airspace. If it's on, you said it was on your front dent, that's okay. But if it's in more in the back of your mouth, usually it's not the tooth which is the problem, but it's there are a lot of nerves from your sinuses which are the problem. But you will feel it actually in your dent.
Yeah.
Well, if it's your dent are as your teeth are as bad as this, then you don't have any problem anymore. Because it can go in and out even you can't stop it from going in and out. As a diver, we are a bit bigger. We all know divers are bigger than the rest of the population of the world. Some divers think they are. But from a physical point of view, it's true. We have more air-containing spaces than a normal being on land. For instance, we have a dive mask, which have a air containing space, of course, otherwise we couldn't see properly. We have a BCD, which is filled with a gas. We have cylinders of breathing gases. We have a suit, especially when you talk about a dry suit, which contain gas. And all these gas-containing spaces are influenced by pressure. So the pressure will change the volume of those spaces as well. So we do have a lot of air-containing spaces which can cause troubles during our dive and during a change of pressure. If we took a look at the dive, we can see different phases in a dive. When you descend, the pressure will increase, so you're in a compression phase. When you're at depth and you're swimming around and looking at the fishes, then you are more or less in the same pressure zone. There's not much pressure change. We call that the isopression phase. And well, at the end, your air or your breathing gas will getting lower and lower and lower, and you decide to ascend again. And then we have the decompression phase, where the pressure is decreasing and the volume is increasing again. If you look at the compression phase, then we see a couple of specific problems for the diver in the compression phase. We call that with the English term squeeze, and actually there is not a real Dutch term for it. It's uitknijpen in Dutch, and that's what happened with the tissues. The tissues, the fluids in the tissues during a squeeze are more or less sucked out of the tissue. And here again, you see the middle ear with the tympanic membrane, trommelvlies, and the eustachian tube. And as soon as the eustachian tube is blocked, there will be a difference in pressure and in volume when we descend, and the pressure on the outside will getting bigger, and the fluid in the middle ear part, where you now see the well, actually it's in the middle of your slide as well. There you have no pressure change, and the problem is that the tympanic membrane, the trommelvlies, can only stand a little pressure change, and when it's too much, it will rupture, and you have a middle ear squeeze with a ruptured tympanic membrane, and trommelvliesperforatie.
Not fun.
Not really funny, though. Actually, it's not necessarily that it hurts very much. Usually, before it ruptures, it hurts, and when it ruptures, the pain is gone. And in one of my courses, we had a professor in sports medicine, which was diving next to me. And during his dive, I saw the little air bubbles coming out of his ear because he had a tympanic membrane rupture, but actually he didn't notice. So that was, it's funny, especially when it is ruptured, the pain can be gone. Also, the sinuses. Sorry?
You hear that often, stories like that, where people have bubbles coming out of their ears when they're equalizing.
Yeah. Then also the sinuses, air-filled spaces with very, very narrow canals connecting them with the outside world. And here again, I also have a little animation, especially of this part of the sinuses. You see them here, nice, clean spaces. no inflammation, no squeezes, and you also see in the bottom part very thin channels to equalize actually those sinuses. When one of those channels is blocked due to a cold or too much alcohol or well, there are allergy, then there is no equalization of the sinuses possible anymore. And when the volume, the pressure increases and the volume shrinks, then you will see that on all the inner layers of the sinuses, the tissues there, the lower pressure sucks the fluid out of the lining of the sinuses. And that's what you see happening here.
Okay, can I just pause you there, Jan-Jaap? I just want to go over a couple of comments from some of our viewers. Curious to see what you think. So first of all, Stephen, he is our resident marine biologist who has given a few presentations here. He has to go, but he will watch it back later. So thank you very much, Stephen. Let's see, and Herem, we do agree it's about time we start diving again. Couldn't agree with you more. Graham from Sydney says that he's been diving for just under 40 years and has only seen 2 cases of DCS, neither particularly serious. And he also says he loves a bit of physics, so good to have you with us, Graham. And Dennis...
Hi, Graham.
Hi, Graham. And Dennis, he decided to take a look at our screen just when you had that picture up of that beautiful set of teeth. So he said, good morning, yuck. Mara, selamat pagi. And then 2 anecdotes. Graham says that a sinus squeeze is mind-numbingly painful.
I agree with that. It's like a knife going through your head, your forehead.
Yeah. And Dennis says he once had a reverse block in his ear.
Yeah, that's very hard. You can't do anything. Clearing,
reverse block.
Equalizing doesn't help anymore. So yeah, you have to go through the pain actually, because you can't stay at the bottom for a long time. Only a very slow ascent might help, but it's an awkward situation.
Yeah. So that's it for the comments so far.
Okay, good. Yeah, please give as much comment as you wish, because I can.
Exactly, and everyone watching, if you have any questions, do put them in the comments, and then when Jan-Jaap is done with his presentation, I'm sure he's happy to answer them.
Yeah, and even during my presentation, you can break in whenever you like. No problem.
All right.
We have other kinds of squeezes. We were talking about the diving suits, and especially when you talk about dry dive suits, but also semi-dry and thick wetsuits. There can be areas where it's filled with air, which cannot ventilate, and you see things like this. It's also a kind of suction on that piece of skin actually, where, as you can see here, even the blood almost comes out, but usually it's only the plasm and tissue fluids. A lung squeeze, which is not very common with scuba divers, but can happen with free divers. Again, here also the pressure increases, especially at very deep free dives, and the volume will decrease. And there is a maximum to that, of course. And the problem is that lungs can collapse actually and can rupture if you go deep with high pressures and you reach the minimum volume of your lungs. Very scary looks. That's the mask squeeze, especially with novice divers. So, and again, here you have the holiday diver, which do not clear their mask enough or at the right time and early enough. And then you get the same problem. The air in the mask is going to suck because the volume tends to shrink, and it's going to suck on your eyes and your skin around your eyes, and you see people like this. And it's funny. The right one is an anesthetist, and can you imagine that he sees his patients in the next couple of days, and they think, hey, am I looking to Dr. Death or to Dracula or something like that?
Some kind of a satanic cult.
Yes. Well, and the problem with this can last for sometimes until 8 weeks when it's gone. So it's for a physician, it's not really a nice situation when you have to see patients. And again, also with the dental squeeze, you have the problems as you explained, Arjen, yourself and experienced yourself. Once we reach depth, we have the isopression phase, and then you don't have many problems with pressure changes. So the squeeze scenario is over, and we have to face some other problems, and those are gas-related diving diseases. And I'm not going into all of them, because otherwise it will take me another hour per subject. But what you experience is what you can experience is a hypoxia. That means a shortage of oxygen, for instance, due to a empty cylinder, empty tank, or a hyperoxia, which can lead to intoxication, too much oxygen, which can lead to zuurstofvergiftiging. We all know that oxygen is toxic once you cross a certain upper limit, and that could be very, very dangerous. And especially when you go deep with a gas mixture, which is not suitable for that depth. Which, for instance, when you go with nitrox, which has an extra amount of oxygen, you go to depth below 40 to 60 meters, then it could be very, very dangerous and toxic. So then you can reach the hyperoxia limit or cross the hyperoxia upper limit and get intoxicated. The same is for carbon dioxide, koolzuurgas in Dutch. You can get hypercapnia when you get too much CO2. For instance, when you have to work hard underwater, try to fight the currents, then you can get a hypercapnia, or you can get a hypocapnia, which is a too low concentration of carbon dioxide, and too low level, I should say. This can happen, for instance, with when you let's see, when you hyperventilate. So you wash
breathe
out
very
the carbon.
deeply and.
Sorry.
So you breathe very fast and very deeply, yeah?
Yeah, you breathe very fast, not deep.
Because you're nervous or something.
Yeah, you're nervous, or when you're out of breath, and then you wash out all your carbon dioxide. And the problem is you need your carbon dioxide also for a trigger to breathe. And that's a problem, especially in free divers. When you don't get that trigger, you don't breathe. And that's nice, because then you can stay on the water for a long time. But at the end, your oxygen level is too low, so you get a hypoxia as well.
I have a couple more comments and questions, or anecdotes rather. Selima is with us. Hi, Selima. Good to see you. And Huub says this is a good promotion for a diving course. I'm suspecting he's referring to the mask squeeze pictures. And Ingrid says, when I flew back from Australia, I developed a cold during the flight due to air conditioning. When landing in Holland, that really hurt, kind of a reverse block. Is there anything I can do to remedy that? The nose was not blocked, so blowing it didn't help.
No. Yeah, well, actually, the only thing, well, what you can do is anti or decongestion medication, like the oh, I forgot the names already. Help. I come back to that later in a second.
Antihistamine?
But also, even when the nose is not blocked, you can use sprays because it's a problem with your eustachian tube, and that's also the nose spray will help there as well. So that's what you can do, and yeah, it can be very painful.
Right.
So Sudafed, I mean, for the anti-decongestion.
Right, something like Otrivin, I'm seeing here in the comments.
Sorry?
Otrivin. Was recommended.
Yeah. Otrivin, that's the spray you can use for your nose. That's a nose spray, yes.
Yeah. And Huub is asking, is it still called nitrox narcosis? Other gases cause narcosis too, right? Isn't it called gas narcosis nowadays?
No. Actually, nitrous narcosis is a specific narcosis with specific symptoms. And gas narcosis, well, actually, there are other gases which can cause narcosis as well. But nitrogen narcosis is specifically pointing at the problem of nitrogen, and also has specific symptoms.
Right. Okay, we'll continue with a few of the... oh, sorry.
It's also the most common form of narcosis.
Right. And there's a couple more, but we'll handle those at the end. So please do continue, Jan-Jaap.
Okay. Well, actually, it's a nice bridge, because nitrogen narcosis actually is one of the last gas-related diseases which I wanted to discuss in the isopression phase. Other things which can happen in the isopression phase is hypothermia, undercooling. It's even when you dive in waters of 27, 28 degrees, when you stay long underwater, your body, which has a core temperature of approximately 36, 37 degrees, will cool down. And hypothermia is a thing which you should be aware of. So wear protective suits in order to prevent hypothermia. Drowning is, of course, a problem. Usually what you see is when you have a lot of other problems, which are the prime cause of your injury, will end up in drowning. Because if you're getting unconscious, drowning is not the reason you're getting unconscious, but you can drown because of your being unconscious. And so there are many other things which can happen before you drown. But a lot of diving accidents are stated as at the end as drowning, or the causes of death is drowning, and that's not really the first and main issue, of course. And the last thing in the isopression phase actually is one of the reasons you go there is the marine life. And one thing you shouldn't do is touch it, because there is a lot of marine life which can be dangerous to us if we are dangerous to them. So don't threaten them, they bite. And even when we're talking about the corals, etc., they have their own protection mechanism. And of course, this is one of the famous marine life where all non-divers are very scared of, and some divers do. But if you don't annoy them, they won't bother you or dare. These are more dangerous actually for us. Not these ones because they don't sting. These ones. This is in the jellyfish lake in Palau, where you can swim with them. They don't need the stingers because they have no animals to kill. But corals, for instance, they have those really nice needles-like stuff, what you can see on the left picture. And when you touch them, you can get the rashes and burns, and they can really last long time, years. You can be bothered by them, and especially when you talk about the very small Portuguese man-o-war. It's a colony of polyps actually. It's not a jellyfish, but they have tentacles. They form tentacles of more than 10 meters on the surface, spread out, and you can really swim into them. And then especially your neck, which is not protected by a wetsuit, and your face. You see on the right picture that these are the scars of the tentacles of a Portuguese man-o-war.
Nasty.
And there are a lot of other jellyfish which can sting and even be lethal, like the sea wasp, and they also have very specific patterns of contact with them. Of course, you have a lot of fish, like the lionfish with their poisonous spines on their back, and only the back spines are poisonous. Don't irritate them. Don't try to catch them. They are sometimes very lazy fish, but they know that they are safe because they can have very annoying injuries because of their toxic stuff in their spines. And of course, the scorpion fish. He's not always the attacker. Actually, he's never the attacker, but he's not always the defender. Sometimes he is the victim himself. As you can see, this one met a sea urchin, and the spines of the sea urchin are still in his mouth. The last phase of the dive, of course, there is always time for an end, especially when you're low on air. You have to ascend again, and ascending means the drop of pressure and the increase of volume again. And well, all divers will notice, especially when they're at considerable depth, that when you ascend, that the volume increases because you're also the volume in your dive suit, even when it's a wetsuit, will increase. So your buoyancy will increase. You get a positive buoyancy, and if you don't do anything, your ascent will be faster and faster and faster. So you have to get rid of some air from your BCD in order to control your ascent speed. But this also happens with, especially in scuba diving, with all the air cavities in your body, because they equalize and you breathe air with the environmental pressure. So at 20 meters, you breathe air of 3 atmospheres. So all the gas-containing spaces in your body also have the 3 atmosphere pressure in them. And if you don't exhale, so you don't release the gas from the volumes, then you will blow up the volumes. And that's the majority of problems you have in the decompression phase are the problems, what you can call, here again, you have the Boyle's law. As soon as you go up, the pressure goes down and the volume increases. What you do there is you have the barotrauma. That's actually the opposite of the squeeze. The squeeze is in decrease of volume, and the barotrauma is the increase of volume. And of course, in the decompression phase, you also have decompression sickness. The barotrauma of the ascent there, the lung barotrauma, is one of the riskiest problems. So that's when you do not exhale during your ascent, you're going to blow up more or less your lungs. and that can result in a pneumothorax, a klaplung, but it can also result in a air gas embolism in your blood, because if one of the little alveoli, longblaasjes, bursts, there can be the air can go into your circulation, and one of the first things, one of the first exit of one of your arteries is the artery which go to your brain. And so if air bubbles go that way, you get a gas embolism in your brain, and that can be lethal. So lung barotrauma is really a thing to consider, and also because of blockage, of course, of your airways due to underlying medical problems or medication can cause lung barotrauma as well. Then you have the middle ear barotrauma, which is more or less the opposite of the middle ear squeeze. In this case, the eardrum will not go inside, but will more or less bulb out. The volume of your middle ear is increasing, and there is a rupture of the tympanic membrane going outwards in the direction of your ear canal. And the same for the sinus barotrauma. Reversed blocks, as were mentioned before, causes that the sinuses are blocked, there is no ventilation, and the air in the sinus is expanding, the gas in the sinuses is expanding, and then there can be very serious trauma, even bones, they can break bones in your skull. And then, of course, you have the decompression sickness. As mentioned, it's not a very frequent thing which happen, but it can be very, very serious as well. Here, the right side, it looks very serious, and in this picture, it is very serious. If I look at the number of rashes on the skin, which is a sign of skin decompression sickness. We come to the other forms of decompression sickness in a minute. But this is a complete total rash, and it's probably not only the skin decompression sickness here. On your left-hand side picture, that was taken during one of our courses in Costa Rica, where one of the guides was struck by decompression sickness. And in this case, I must say, fortunately, there were 1, 2, 3, 4 doctors around him on the boat. And they really did a very adequate thing in giving him oxygen, which is the first aid for decompression sickness as well. And at the end, of course, the recompression chamber was not working. They have one, but it was not working, and they held him one night on 100% oxygen, and the symptoms were disappearing after that one night. Not a problem was, of course, he was not insured, and the next or the closest decompression chamber was in Panama, so transportation to that was not. Should have been an option, but it was so serious. But fortunately, 100% oxygen was enough here. Decompression sicknesses, you have several forms of decompression sicknesses. You have the skin decompression sickness, which you just saw. You have them in the joints and bones, and you have them in the central nervous system, which is the brain and the spinal cords, and also the inner ear decompression sickness. Especially the last two forms of decompression sickness are really can be really serious forms of decompression sickness, and in recreational or vacation or holiday divers and diving holiday diving divers, the most frequent form of decompression sickness. It's a form usually due to a too rapid ascent combined with a long underwater dive at a considerable depth. So that happens more often in the recreational divers, while joints and bones is usually more in divers who are doing caisson work and are under pressure for a very, very long time, let's say about 8 hours or 10 hours a day. And they are really saturated. The bones, which are very slow tissue, take long for them to saturate with nitrogen. They are saturated with nitrogen after long working hours. Skin decompression sickness was also considered until about 15 years ago as a minor type of decompression sickness, but nowadays the more or less general opinion is that it's also a form of central nervous system decompression sickness, because the effects of the skin decompression sickness, it's combined with nitrogen bubbles, which can be seen in the heart, and that's it's very strange for a local decompression sickness, what skin decompression sickness was always thought of to be. So nowadays it's seen as a more serious form as decompression sickness as 20 years ago. This is the typical form of skin decompression sickness, where you see the rashes, especially on the lower part of the breast and the upper part of the abdomen, and also on the hips it can be displayed. Again, here also maybe not. It's not always necessary to give treatment, but it's always handy to be aware that it can develop, and to more serious situations, and always give 100% oxygen here, and again be aware. So try to be able to reach a recompression chamber or facility easily, if possible.
Just a few more comments, Jan-Jaap, if you don't mind. Let's see. So Graham says that marine life. Oh, could you do me a favor and turn down your volume a little bit, because I seem to be echoing through your speakers. Thanks.
Me?
And yeah. And Graham says that marine life, rather like DCS, is a very low percentage problem, sometimes uncomfortable, like fire corals, men of war, and jellyfish, but rarely fatal. And he, in and of themselves, in my experience, he says. So you're still alive, Graham. That's always good to know. And they also have an Irukandji jellyfish in Australia, which is very nasty. Luckily tends to be close to shore in the mangroves in areas where divers tend not to dive. Let's see. Salima got stung by a man of war. Take care of yourself. It's painful, but not too bad. I hope you don't get any scars. And Graham says that, don't you like how we call them blue bottles to kind of make them less scary? I love that typical Australian downplaying of anything that's even remotely threatening.
Yeah, that's true, and it's correct. Most of the marine life is not fatal when you touch them. Even the Portuguese men of war, only very, very, very few fatal accidents are reported by contact with a Portuguese ship of men of war. But the problem is that sometimes people, like they are stung by a bee, they can also die just because they are allergic to the poison, and they get a shock. They get into a shock, and that can happen with those jellyfish as well. Though I must say, the Irukandji and the sea wasps, I won't advise to try if you can survive that, because they are the most poisonous animals actually in the world, though the irukandji is only about a centimeter, and it's hard to see, but the amount of toxin can kill about 10 people. So it's not a nice idea it's not a nice research project to see if you can survive. That's too risky.
Sounds terrible. Question from Yvonne: do you know a cardiologist or a dive doctor in the Netherlands?
Yeah, sure. There, you can find all the dive doctors also ordered by speciality on mijnduikerarts.nl, mijnduikerarts.nl. There you can find all certified diving doctors, and there you can look at the and you can choose the cardiology, for instance, a specialism, and then you will find the cardiologists who are diving doctors in the Netherlands as well.
Right, perfect. And yeah, please do continue. We'll pick up the rest at the end of your presentation.
Okay. Well, actually, it's coming close to an end. Well, for treatment of decompression sickness, as I mentioned earlier, 100% oxygen is the first treatment for all diving accidents. It's for barotrauma. It's even for hyperoxia, een zuurstofintoxication, een zuurstofvergiftiging, and oxygen intoxication is 100% oxygen still the first treatment. But if you need any further treatment, you can increase the oxygen, partial oxygen levels by putting people under pressure and giving them 100% oxygen. And that's done in a recompression chamber. Here you see two examples. The upper example is the Burema chamber in Amsterdam, in the Amsterdam University Hospital. And the lower part are two chambers in the Royal Navy of Oman base, and they are also used for treatments of non-military personnel. So that's used quite often also for other reasons than diving accidents, other indications where hyperbaric oxygen therapy is used for. Prevention. Actually, it's for both, but for the holiday diver, which are not very which not very known with dive computers, the correct use of a good dive computer is really a means of prevention for them. You should know your computer, and even more experienced divers who got a new computer try to know your computer, because once my buddy, she was quite a experienced diver and had a new computer, and thought that her bottom time was displayed, but it was the decompression time, and so it was increasing was the decompression time, and she was far in deco. And then she showed me, and I said, well, maybe it's good to go up a bit, because this is not your bottom time, but now you have to make a decompression stop of 20 minutes, and that's that are things which can be very awkward when you're.
I've had some experience similar to that here as well. Yeah.
And especially when you don't have your own dive computer, you get one from your dive operator, and here is your dive computer, and you know how it works. Yes, and then at the end it's hopeless. Take enough rest. If you're not planning your dives well enough, don't make 3 dives a day as a holiday diver. Don't dive for 5 days as a holiday diver, and in between dives also take enough rest. That's why you're here. You're a holiday diver. If you're on a diving holiday, There are other things you have to take into account, like the right gas mixture if you're diving with nitrox or Trimax or Heliox. It's make sure you have the right gas mixture for your dive. Make a good dive planning, and also here take enough rest. It's very tentative to make 5 dives a day during your 7 days holiday. So at the end, you have 35, 40 dives in a week. Well, that's too much, even if you're well trained and not too old, and it's too much. And again, take enough rest and hydrate, drink, and especially drink water. No alcohol to hydrate, because that doesn't work very well. So that is our preventive measures you should be aware of always. Well, on all good things comes an end, and then you have the return flight for both the diving holiday divers and the holiday divers and the diving holiday divers. The rules of thumbs are: after one single non-decompression dive, at least 12 hours no flying. After repetitive diving or decompression dives, at least 24 hours no flying. Recent research of DAN, Divers Alert Network, showed us that the bubble formation, especially when you lower the external pressure, which is the case in an airplane, the bubble formation in the airplanes were measured even after 30 hours of diving. So keep in mind and don't be too relaxed about flying after diving. Well, to conclude, the take-home messages: always have a recent diving medical examination done by a certified diving physician. Well, one of the questions was already about this one. That's really key thing, I think. And there are two key things: recent. So if you had a diving medical every 2 years, and when you're getting older, maybe every 1 year, and also see your diving doctor after you had an accident, because that, or when you change your medication, because that can also influence your dive or your dive ability and your dive safety. And it's not that you're disqualified for diving, but he can advise you and give you some guidelines how you can dive safely with your new problems, your injuries you had, which would not necessarily even be dive related in the first place or caused by diving. And then therefore it's very important to see a diving medical examiner, a physician who knows about diving medicine, because he can advise you. He knows about diving. He knows the specific things which are key for your health in hyperbaric, overpressured situations. Explore your dive destination before diving. It's always nice that you know where is my first aid, where is a good dive operator, how is the equipment of the dive operator, where can I find the nearest recompression chamber, and also on a more micro level, it's essential to see how is your dive spot, how can I go in and how can I go out without getting hurt. How is the current? Are there any down currents that you're not surprised by that? So try to be informed before you dive. Be well hydrated before diving, especially when you start diving immediately after you arrive and had a long flight, or when you had a very, very cozy and cheerful night before. Don't go diving when you're still drunk or close to that. Don't even try to touch or approach marine life, flora nor fauna. It can be very, very nasty, though not necessarily lethal. But I also know that someone about 15 years ago, I was in Lembe, and someone found a very, very cute little octopus, and he put it in his pocket of his BCD, and that was a blue-ringed octopus. And I think it's not nice when you're staying.
Put it in his pocket?
In his pocket of his. Well, I don't know
Okay.
whether it stayed there, but he tried to keep it in there, and at the end, he was stung in his hand, or bitten.
So
actually,
bizarre.
I should say, in his hand. Make maximum of 3 dives a day, and after 2 or 3 days of diving, just keep 1 day of rest and refrain from diving. Usually the areas where you dive are really nice, and there are a lot of other things to do, and that gives your body a moment of de-gassing, off-gassing, and get rid of a overshoot of nitrogen, and because diving is restraining for your body as well, even when it's relaxed diving. And watch your no diving time before flying, the 12 hours one dive, 24 hours multiple dives, or decompression dives. But at the end, what we see is that diving is awesome, and usually it's a very, very safe sport. There are not really many diving accidents. So yeah, if you dive responsibly, then it's a very nice sport. And unfortunately, COVID prevented us from diving. It's another presentation worth to talk about COVID and diving after COVID. And also for the dive operators, it's getting a very tough time to get all the equipment, rental equipment, free of any COVID influence, and that's
it's a lot of extra work.
That is a lot of extra work, and that's a thing which will be the next couple of years, I think, an issue. Okay, any more questions?
Wow. Fantastic. Well, first of all, thanks a lot, Jan-Jaap. That was great. Graham's got a long comment about that it's always recommendable to use O2, even if you suspect even the slightest amount of decompression, or even if you don't need it, just it's better to be safe than sorry. You would agree with that, right?
Yes. Well, actually, when you're not even near a decompression limit, I think it's a bit of overshoot. It's there are people who are using O2 and not diving. I think about the Michael Jacksons in this world, and again, 100% our oxygen is toxic, and 100% oxygen can give, if you use it long enough, or under high pressures, can be immediately toxic, but it can also damage the quality of your lungs. So when it's not really necessary, or when you don't suspect or expect any problems with decompression sickness, I feel it's not necessary to use 100% oxygen after every dive.
Right. And well, Simone, she posted, because her connection is really terrible, so she cannot interject properly. But she says that we always put everyone on O2, even if it might be something else. It's just better to be safe than sorry.
Oh, that's true. When there is a cause to use it, because there is a diving accident, or people don't feel very well, then yes, I agree with that fully. Yeah.
And Albert is commenting about skin DCS, and it's a good treatment, and he knows that from experience.
Yep, sure. Yeah.
So Salima, Graham says that Salima is volunteering to try the Irukandji Sting for the benefit of humankind. Such a nice man, Graham. And Albert is asking, does your organization give courses to interested people who are not doctors?
No, we don't actually. That's a very hard answer, but it's no, we don't do that. We are thinking about that to do that through another organization which is connected to our organization, or which might be a son or daughter of our organization, to do that. To give courses for people who are interested in diving medicine, and also for dive operators and dive guides, etc., etc. And we are looking into that together with DEN, Divers Alert Network, to set up courses for those who are interested and are not medical. But the Scott Haldane Foundation will always give courses only for medical people. But
right,
yes,
thank
we
you.
work on that.
Yeah. Let's see. Yolanda, she's saying it's good to figure out where you can get oxygen and where the closest decompression chamber is, because some famous dive site in Belgium, a diving tower in Belgium, they didn't even know. So that's just a general tip.
Yes, well, actually, that's correct. That's one of the things you should know, and that's one of the things you also should do in your exploration. If you go to a dive operator, be sure that they do have those 100% oxygen, and all dive boats have to have these cylinders with 100% oxygen. And also on the dive operations, usually there is a big tank with 100% oxygen, because it's the #1 first aid in diving accidents. So also on dive boats, when you go, for instance, to Manado, Bunaken, and an accident happened, you should be able to give 100% oxygen immediately. So yes, so all dive operators should have 100% oxygen. And yes, one of the good things is be aware that where the closest recompression chamber is. It really amazes me that Nemo does in Brussels. They don't know about the recompression chamber because it's about a kilometer from them, away from them. Well, 3 kilometers away from them, in the military hospital of Brussels, and they do a lot of research together with DEN. So it's probably the person there she talked to who doesn't know, but Nemo, yes, they know about a lot about diving research and accidents.
Well, Jan-Jaap, time just flew by. Thanks a lot for your very interesting presentation. The comments are flooded with people who are saying thank you. I learned a lot. It was great to, and there goes Simone again. She's got a terrible connection. And people are saying thanks a lot for refreshing my safety knowledge, among other things. And so yeah, once again, thank you so much for your time and for preparing this fantastic presentation. I certainly learned quite a bit in the last 1 hour. So once again, thank you so much.
Okay, it was a pleasure to do it, and hope to be back once more, and at least that we had the chance to discuss things in November when we are hopefully are in Manado again.
Yeah, definitely. And we keep saying that every week. It can't come soon enough. It's getting a little bit ridiculous, this situation, but we're hanging on. And once again, thanks to your kind donations. If you haven't visited the website yet, you can visit gogetfunding.com/helptalassa. If you know anyone in your network, you can also help us by sending them to us, and maybe you think they're interesting to feature on our live stream. That's also, of course, more than welcome. So, and as usual, of course, please do spread the word, and do get the word out about us. Let everyone know about us. We need as many eyes as possible on us. We need that attention for better and worse. Simone, how are you doing?
don't hear you. Well, I'm in and out, in and out, in and out. So yeah,
Yeah.
it was not my best stream. Let's say that. So my apologies to everybody.
Yeah, let's
I
make
tried
it
to give some comments
better one next time.
on the stream.
I saw that. Yeah.
Jan-Jaap, sorry. And until now, there is still some echo. I have no idea what's going on.
No, but anyway.
But it seems from all the comments that it was very well received and everybody really liked it.
Yeah.
Nice to hear.
So
nice to hear.
That's thumbs up. Thank you very much. And
Okay, no problem. Did it with pleasure.
All right, Jan-Jaap, do stick around with us.
Yep.
We're going to say goodbye to everyone else. So everyone, thank you very much for joining us once again. We will see you again 2 weeks from now. And next Saturday, we will be having our Zoom party. Jan-Jaap, feel free to join us. And in the meantime, take care, everyone, and stay safe, stay sane in these crazy times. And we hope to see you all again on our next stream. Goodbye, everyone. Take care. Stick around, Jan-Jaap.
See you guys.
Later. Bye.
Hope you can
Bye-bye.
hear me.
Bye-bye.